My name is Augusto Carlos. I am a registered nurse in this clinic. May I know what brings you here today?
Hello. My name is Vanessa. I am the daughter of Wesley Albert, who is a regular patient in this clinic.
Oh, yes. I am Wesley's attending nurse in the clinic. How may I help you today?
Nice to meet you, nurse.
Thank you. I am glad to meet you too.
Actually, I am here with an inquiry regarding a blood test.
All right. I hope I can help you.
Okay, nurse. During the last visit, my mother has been advised to go for a blood test. But I wonder why she needs that, as she is quite healthy and nothing seems to be wrong with her.
Your question is really sensible, and I am glad to help you with the answer. Usually, as the age increases, there are chances to get more disease. A routine blood check for a person in your mother's age would be quite beneficial to check the general health status, liver, and kidney function, as well as the impact of current medication on her. Am I clear so far?
Oh, yes.
So, just consider blood tests as a part of routine check, like blood pressure or a cognitive function test. Is that okay?
Yes, now I am clear about the reason to have a blood test.
All right. Do you have any other concerns?
Yes, nurse, even though a blood test is necessary, I really don't like the idea of pricking my mother, as it causes bruising after every blood test.
Being a daughter, your worries are appreciable. Bruises are something very common in older people. It is because their skin is very sensitive, and the veins are less pronounced.
Okay.
But there is nothing to panic about. It is usually harmless and fades quickly.
Oh, I see.
And if your mother experiences any sort of pain on the site of the blood test, she can administer paracetamol for the pain relief.
All right, nurse, but my major concern is about her fasting.
Fasting? Can you please make it clear for me?
Sure. During the last test, my mother fasted a whole day prior to it. Does she need to do the same for this time? If so, I don't appreciate the idea, considering her age and physical health.
Your thoughts are considerable. I can give you a brief information about fasting. Shall I proceed?
Sure.
First of all, it is not necessary to fast the whole day. I would like to suggest that fasting for 8 hours, with water consumption and regular medication, is fair enough for a blood test.
Okay. I understand that.
And I strongly advise your mother to carry out the blood test in the early morning, so that a lengthy fasting can be avoided.
Yes, that's the best option my mother can follow.
Thank you for accepting my suggestion.
By the way, nurse, if her report finds any abnormality, then what would be the next step?
That's a very good question, Vanessa. If there are any findings in the report, it is best to fix an appointment with the GP to discuss the results and get an appropriate treatment.
All right, nurse, I will do that.
Meanwhile, I would like to suggest you to accompany your mother during the test and her follow-up appointments, which helps her to gain confidence and trust during the sessions.
Sure, nurse. I can come along with her.
Good. I hope I have clarified all your doubts.
Yes, nurse, thank you.
It's my pleasure. Looking forward to meeting you on the test day.
That is the end of your OH.